Welcome to the first episode of the Cellular Shift. I am Dr. Alita Sikora, owner of Sikora Integrative Medicine in Vero Beach and the host of this show. Today, we will be discussing medical trends, topics, and solutions to help you improve from the inside out. And my co-host today is our resident nurse, RN Amber Crittenden.
Hello.
So let's talk about the first topic of this show. We are talking about health hot topics. What's trending now in medicine? Has anybody heard of peptide therapy? Peptides and why are they important? Have you heard about peptides, Amber?
Yeah, peptides are great. A lot of patients use them and I see them coming in saying they feel a lot better. So
Yes. So peptides are really trending right now. I see them all over social media. What are peptides? Peptides are natural amino acids. Amino acids make up proteins. So these are natural molecules that we have in our bodies, and we are just giving ourselves a natural molecule that is stimulating responses at the cellular level. So it's actually a natural thing that's already going on. We're just waking up our body. Some people call it biohacking.
Yeah.
And in my practice, I see people getting so much better and improving without needing drugs or injections.
Helping decrease the inflammation and stuff. And
Yes.
lots of different things.
There's one we use a lot called BPC 157. And there's another one with TB 500 that's called the Wolverine. It helps heal in like half the amount of time. People recover from surgeries, injuries. I inject it into joints for arthritis. We have other peptides that help boost the immune system.
Yes.
We have peptides that improve growth hormone to help you with your sleep, to help increase lean muscle mass. So it's really a nice adjunct to the practice because we can give you natural solutions that have very little side effects.
Yes.
I really have not had anybody have any, and can help really improve your health without needing a lot of drugs.
Yeah. And like you said, there's no side effects. It's not the pharmaceutical medication. So you just get the benefit of it, which is amazing.
So our next segment is called Healing in Action. And for this, we have a special guest. It's one of our patients. He's agreed to come on and be part of the show.
He's so cute.
He's wonderful. His name is Thomas Peterson. He will be coming on. He's going to be talking about his experience getting stem cell injections in his knees. He's also had some IVs, but he'll be telling us about how he did.
Yes. Bye.
Welcome to Thomas. He is a patient here. He's joining us to talk about stem cells in his knees. When Thomas first came to see me, he could barely walk. He was in so much pain. He was on a walker. He came to me. He'd had surgery years ago. He didn't want to go through it again. And he was just asking what were his options. Do you remember that?
I certainly do. And I did come in here with a walker and a cane, and I really could not walk. I was done. And I had 2 partials put in my knees about 20 years ago, and they are still perfect, but the other pockets have worn out. And the doctors I've talked to want to cut the whole top of my knee up and often realign them. And I thought, well, that sounds like a big recovery procedure. And after they realign my knees, what happens to my hips? Well, Dr. Sikora, who I trust with my life, came to me with an outstanding idea. She said, why don't we try? And the first thing we did was we did the
platelet-rich plasma, from your blood.
And I think that would be a very successful treatment for someone who's a little younger than I am. We're asking a lot of cells at my age to rejuvenate, and that was something they could not do. So what we did, I came in here with my walker, and we put a shot in each of these 2 knees, and within a couple of days, somebody looked at me and said, "What's different about you? Your posture has changed." My posture had changed because I could stand up straight on my knees, and the rest of everything else fell into space. So if you want to grow 2 inches, that's a good way to start.
Well, what about your pain?
The pain is, they don't like going up and down stairs. I'd be the first one to admit that. Are they perfect? They are not. Are they 100% better? You bet. I can walk and do just about anything I want. I can dance. How's that?
Well, you just went on a vacation. You were hiking. You were going up
Hiking,
and downstairs.
sure,
You
up
walked
and
on the
downstairs,
beach.
walk on the beach, all of what, and I like to shoot skeet and sporting clays. So that's it takes a little bit of energy and a little bit of walking around. But the reality is, this is way, way ahead of whatever was in second place.
Yes,
And I'm
yes.
very grateful for
Oh,
Dr.
thank you.
Sikora.
Thank you so much. So yes, what we did is we took umbilical cord stem cells, or what we call Wharton's jelly. The umbilical cords are taken from live births, from C-sections. They go to a blood bank. There are some very strict regulations with the state regarding the licensing and testing. And we receive the actual stem cells, cryopreserved. We thaw them and then we inject them. I injected in the medial part of his knee where he did not have any surgery and where he had almost bone-on-bone arthritis. And he's gotten, I mean, if you had seen him walking in here in pain on a walker, I mean, this is a completely different person that we're seeing here. And even he was telling me the other day he plays bridge and his bridge partners have noticed it.
Yes, I do play competitive bridge, and the 10 is a hotbed for that type of activity, having the third largest bridge club in the world, so it is competitive. And my partner was complaining that I was getting a little scatterbrained, having a little difficulty remembering things. And I got to tell you, I took those peptide shots.
Yes.
And I know that's not what they're designed for, but
That's
guess
right,
what?
yes.
It was a super side benefit.
Well, the
And-
peptide you took was the BPC 157, which stands for Body Protection Compound. It's derived from gastric juice that's natural. That was to help with the healing and inflammation, but it also helps decrease neuroinflammation.
Right.
It helps with your energy, so it helps overall healing. And then you've also had some IV vitamins, which have helped your energy.
Enormously.
So this patient has just done so well, and I'm so grateful to you for coming on today. Thank you so much.
Well, guess what? I'm
Thank
very
you.
grateful to you, too.
Thank you so much. So welcome back, Amber.
Thank you.
So we're on the next segment of our show. It's called Innovations in Healing. We're going to talk about our IVs, our IV treatments here at Sikora Integrative Medicine. We do a basic Myers cocktail. I don't know if anybody knows, but that's the one that most people come in and do. Amber's going to explain because she's the one who's actually mixing it up and giving it to you.
Yep. So our Myers is like your basic overall. We have vitamin C, B1, B2, B3, B5, B6. We have our B12. We have calcium, zinc, and magnesium in it. So these nutrients and antioxidants and minerals that are in there, they're the most basic that you lack on. So everybody's really safe coming in to get them. But we do consults. So come on in for a consult and we can decide which IV is like best for you.
Yes. So anytime I start to feel sick or I'm going to go on a trip and I don't want to get sick, I have Amber give me an IV, and she always adds some extra vitamin C, extra zinc, some lysine. It really boosts my immune system.
Yep.
So the Myers is kind of our basic cocktail, and then we can do add-ons, and that's where it's really individualized, and that's where you come in and talk to us.
Personalize it for you.
We might do some additional testing, like the micronutrient testing. Some of these tests are covered by Medicare. The IVs themselves are not, but we do have an IV membership that we're starting.
Yeah.
That's where you can get a basic Myers once a month at a discount.
Mm-hmm.
You can tell us
and
a
we
little bit
can
more
also
about
do
that.
some immune. We can target your immunity or your energy. And then you also get 20% off of add-ons and stuff like that. So there's different perks. Another IV that I wanted to talk about too was the NAD. That's a big one.
Yes, NAD is really hot right now, again, on social media. We've been doing it for years, but all of a sudden it's just really exploded because everybody is cells and cellular therapy is really big right now, the biohacking. So the NAD helps improve cellular energy.
Yeah.
And who doesn't have fatigue?
Yeah.
It helps with pain. It helps with brain fog. Amber's going to explain a little bit more about how it actually works at the cellular level.
Yeah, so NAD is a precursor to go into the powerhouse of the cell, which is like the mitochondria of the cell. And it makes that powerhouse or mitochondria produce lots of energy. When the cell has energy to do its job, then it can not only carry out its cellular function, but when it replicates, you replicate a healthier, more revived and energized cell, which is what we all want. So getting regular infusions of NAD is anti-aging.
Yes.
But
yes.
it can also help problems like fibromyalgia, people with pain and neuropathies, fatigue and long COVID. Like anytime we stimulate the mitochondria, you're going to feel better. It's going to start helping you. So NAD is awesome if you want to come in.
And if you don't want an IV, we can do it as an injection or even a nasal spray. So there are other options if you don't want IVs.
Yep.
Our third one I have to mention is IV CBD.
It's my favorite.
CBD is amazing for pain. We just had the patient come. He's had that as well to help his pain and inflammation. I mean, remember we went and had the IV CBD ourselves. We had so much relief of anxiety. We slept well. What else?
Yes. I mean, well, I got a little bit giddy at first. I'm not going to lie. But after that, you just feel very relaxed. You're not worried about things that would normally concern you or cause you anxiety. The sleep is great and the pain just goes away. For me, it went away for almost 3 weeks area. Wow. So that was really good.
That's pretty good.
You know, some other people are only experiencing like a week or 2 weeks. So it really just depends.
And that's, again, part of the membership where you can come once a month and get this. And it builds up in your system to really help reduce the inflammation and the pain.
Yes, it's awesome.
So we're really excited. We have these IV treatments, we have peptides, we have hormones, we have stem cells. So if you're interested, please call or make a consult. I can also do televisits, phone calls. So I'm really excited to bring all these services outside of our immediate community.
Yes.
Thank you. And I'm Dr. Alita Sikora. Thank you very much for joining us on my first episode of the Cellular Shift with Amber, our RN. Take care.